We're going to do another round of questions and for 5 minutes each. Mr. Fetzner, as you talked about the state of HIT adoption, maybe you could talk about the state of HIT adoption and integration in the long-term care industry. Obviously, an industry that continues to grow. All of us baby boomers will eventually be at that point. And, how will the provisions in the stimulus bill improve that adoption? And this sort of just goes into the conversation that we're just having, the integration, and there's people that go in and out of those facilities or in and out of those care sectors. So if you could address that.
As far as the state of HIT adoption in home and community-based care, it's pretty limited. You do have providers implementing telehealth and telemonitoring, but again, it goes down to that information is being reported back to that single service provider, which then they're doing something with, and it's really not interconnected into different aspects of the healthcare delivery system. With regards to the stimulus bill, one of my concerns in the stimulus bill is its emphasis, what I might consider overemphasis on EHRs as one component of that entire system. It's an important backbone and it's critical, but it's not necessarily sufficient. And so from the stimulus perspective, it would be nice to see a more balanced investment across the entire network of providers, where you would lay many different seeds of investment with pilot projects and things across many different settings. I think that would help to create almost that tipping point of adoption, where now physicians who never had the information before now will have different information and begin to realize, oh, that is useful to me for X, Y, or Z, or whatever that might be.
Thank you. Dr. Stuckey, how much success has the eye care community had in working with CCHIT to establish criteria for certified HIT systems? And what are some of the unique challenges that you see your community facing on this front?
Well, after giving testimony, I was fortunate enough to have a conversation with Dr. Cressley and her husband, so the amount of the positive feedback that I got, I will have to say that we are going to be, we feel fairly assured that we're going to be successful relative to our the results coming out of CCHIT. And the second part of the question was?
Just what are some of the unique challenges that you see the optometric community facing on this front?
Yes, it's very similar to what was previously said. I mean, basically the industry being somewhat fragmented as it is, presents itself to, with the HIT issue, for it to be fragmented also. So as far as the challenges that were spoken to in terms of interoperable and interconnectivity, that's the challenges that we see in the future. So I'd say everybody's really speaking the same language here, and I think if you look at it across the segment of the different healthcare representatives that we have, I think it's very similar.
Dr. Cressley, you brought up a lot of different points that I found very interesting, in terms of the immunizations, and I think that's what you're referring to when you're talking about this physician and more, and being able to download that, which obviously as a mother of 5 and even myself, when I went to the doctor, they said, when's the last time you got a tetanus? Most of us have no idea. And so we just get it anyway. But the other point, though, that I wanted you to maybe expand a little bit on was the state's abilities to define meaningful use. And, I'm from the northwest corner of Pennsylvania. There's a 45-mile difference between New York State and Ohio in my area. So we've got physicians and patients sometimes going back and forth. So maybe if you could address that just a bit.
Thank you. I'd be happy to. Thank you. I think that presents a big problem. The way it appears as if the ERA funding under Medicaid is going to allow states, their own state Medicaid programs, to define meaningful use. And I think that poses a problem for especially physicians practicing on borders. And the panel was actually speaking at the break. We would like to see government try to make the meaningful use definition as broad as possible. The more you hone down and try to make it specific, the more you're going to exclude people from adopting technology. And what we want to do here is actually promote increased adoption, not exclude people or give them reasons not to adopt. And so the broader those users, meaningful use definitions are, that could cross state lines and apply to different Medicaid programs across state lines, the more easy this will be to implement, and I would expect more easy for the government to actually be able to certify that people are using things meaningful. So I would urge everyone to consider that meaningful use should be broad and easily implemented in broad categories so we can catch as many people and promote as increased adoption as possible, widespread among different users with different needs.
Thank you. And I would actually ask those at the panel and anyone else in this room who's interested to kind of look at the open comment period here now, and when they have one in the future, and put your input in. You obviously have some great things to say. I'm now going to yield to Mr. Westmoreland. And